Mushrooms have been used as a food and a medicine in cultures around the world for thousands of years. Several mushroom species have been used in integrative cancer care. A wealth of evidence has been gathered in support of the usefulness of the turkey tail mushroom in particular, and numerous clinical trials show that the turkey tail may improve survival in people with cancer. Coriolus containing polysaccharides, abbreviated PSK and PSP, have demonstrated immune-enhancing and anti-cancer potential, and they've been used routinely in cancer care in both Japan and China for decades. Preclinical and clinical studies suggest the PSK and the PSP have direct anti-metastatic effects, and they promote anti-cancer immune activity. Because the PSK and the PSP stimulate healthy immune function, this might be beneficial combined with chemotherapy, radiation, or surgery, which all weaken the immune system. In a systematic review of 13 randomized, placebo-controlled, double-blind trials in patients who are receiving the turkey tail mushroom for various cancers, the risk of dying due to cancer was lower in the patients who were taking the mushroom. This finding was particularly true in patients with breast, colorectal, and gastric cancers. In a study of patients with advanced liver cancer who had poor liver function or who couldn't take standard treatment, this mushroom improved social and emotional function, appetite, pain, and the quality of life compared to placebo. A review of 28 studies, including 6 randomized control trials, 5 non-randomized trials, and 17 preclinical studies, noted the important benefits from the PSK in lung cancer treatment. In general, the PSK demonstrated safety in the patients undergoing radiation therapy or chemotherapy, and they had beneficial effects on the immune function. It helped with symptoms caused by the tumour, and it appeared to extend the survival in patients with lung cancer. A meta-analysis of 23 randomized control trials that included a combined total of 10,684 patients with colorectal, gastric, or esophageal cancers found that the PSK improves survival. The benefit was more dramatic in patients who were treated with both chemotherapy and PSK. One trial specifically looked at individuals older than 70 years. After colon cancer surgery, the study participants who received adjuvant chemotherapy plus the PSK had a 3-year survival rate of 81%, while participants who received adjuvant chemotherapy alone had a 3-year survival rate of 53%. The PSK at a dose of 3 grams daily for 2 weeks each month was also reported to improve the survival in a study of patients with cervical cancer being treated with radiation. Quercetin is a flavonoid found in almost all plants and present in a broad range of food, from grape skins to red onions to green tea to tomatoes. Like other flavonoids, quercetin has free radical scavenging, anti-inflammatory, antimicrobial, and immune-modulating characteristics. Quercetin has been found to interfere with cancer cell division, to promote cancer cell death, and to interrupt tumour signalling necessary for cancer growth and spread. Also, quercetin might enhance the effectiveness of some chemotherapy drugs for various cancers. Quercetin has demonstrated anti-cancer effects against various types of cancer cells in the lab, including lung, liver, prostate, and breast cancer cells. The effects appear to be related to the ability of quercetin to reduce oxidative stress and inflammation. In prostate cancer cells, quercetin has been found to reduce hormone receptor function, to alter gene activity in favor of tumor suppression. In breast cancer cells, the quercetin exposure reversed the resistance to tamoxifen and increased sensitivity to the chemotherapy drug doxorubicin. It also inhibited breast CSCs, which are thought to play a major role in cancer metastases, recurrence, and progression. Findings from animal research suggest quercetin might protect the liver from carcinogenic toxins, inhibiting liver cancer growth, and improve sensitivity to the chemotherapy drug 5-fluorouracil. In animal models of breast cancer, quercetin has been found to inhibit tumor growth, strengthen the immune response to cancer, and increase the effectiveness of doxorubicin. Reishi, or Ganoderma lucidum, is a mushroom that's been used for thousands of years in many parts of Asia as a remedy to treat an array of diseases and to prolong life. Polysaccharides from reishi, like those from other mushrooms, have immune modulating properties. Furthermore, the reishi has been shown in pre-clinical research to be toxic to cancer cells, inhibiting new blood vessel formation, reducing proliferation and other activities of malignant cells, and protecting healthy cells from the toxic damage, making the reishi a promising adjuvant cancer therapy. Reishi polysaccharides might have a beneficial effect on bone marrow, the source of red blood cells and most immune cells. In an animal study after bone marrow eradication by chemotherapy, the reishi improved the recovery of both the red and the white blood cells. Reishi increased the number and the function of certain immune cells, including natural killer cells, antibody-producing B cells, and some T cells. The reishi has also been shown to inhibit several aspects of the inflammatory response. Through these mechanisms, reishi might suppress a variety of pro-cancer cellular pathways and decrease some harmful effects of conventional cancer treatments. In addition to polysaccharides, reishi contains compounds known as triterpenoids, which may contribute to its health benefits. The reishi triterpenoids have free radical scavenging capacity, and they've demonstrated the ability to reduce the proliferation, to induce cell death, to suppress signaling need for new blood vessel growth, and to inhibit metastases in cancer cells. Lab and animal studies indicate that reishi triterpenes are also anti-inflammatory. In a randomized placebo-controlled clinical trial, a triterpenoid and polysaccharide-enriched reishi preparation increased the activity of antioxidant enzymes in healthy volunteers. A Cochrane review of 5 randomized control trials that met the strict criteria for the highest level of evidence concluded that while reishi might not be effective when used alone or as a first line of treatment for cancer, the evidence supports its possible use for an adjuvant to use to enhance the tumour responsiveness, preserve strong immune function, and improve the quality of life in patients with cancer who are undergoing conventional therapies. This conclusion is important as Cochrane reviews are often used as high-quality evidence-based guidance for medical decision-making. Another review of findings from both preclinical and clinical studies reached a similar conclusion regarding the use of reishi as an adjuvant breast cancer treatment. A small human study reported that a reishi extract enhanced immune function in patients with advanced cancers. In a study involving patients with pre-cancerous colorectal polyps or adenomas, a water-soluble reishi extract decreased the number and the size of the adenomas seen on a colonoscopy. In another study of patients with advanced colorectal cancer, the administration of 5.4 grams of reishi for 12 weeks improved several markers of immune function, including the activity of natural killer cells. Resveratrol is a non-flavonoid polyphenol and a phytoestrogen. Resveratrol is one of a diverse group of plant compounds called phytoalexins, and these function like a plant immune system, defending against microbial invasion and activated by other stressors. Resveratrol has been identified in at least 72 species of plant, including cocoa, peanuts, Japanese knotweed, a variety of berries, and red grapes. Because of its oxidative stress reducing and anti-inflammatory properties, resveratrol might have a role in preventing and treating chronic degenerative diseases like cardiovascular disease, neurological disorders, and possibly cancer. Resveratrol inhibits inflammatory signaling through NF-kappa B pathway, and this effect increases with higher doses of resveratrol. In addition, the compound has been shown to directly inhibit cyclooxygenase 2, or COX-2, an enzyme that's involved in inflammation and cancer cell metastases. Resveratrol has been shown to inhibit the proliferation and to promote the cell death in a variety of cancer cells in vitro. It also appears to induce epigenetic reprogramming that favours healthy cell function. In addition, resveratrol might help to sensitize cells to the effects of chemotherapy. In a randomized, double-blind, placebo-controlled trial involving 39 women at an increased risk for breast cancer, participants received 5 mg or 50 mg of trans resveratrol twice a day for 12 weeks. The women then underwent a procedure to collect the ductal cells for analysis. Increased activation of a tumor suppressor gene and decreased production of a pro-inflammatory and pro-malignancy chemical called prostaglandin E2 were seen in the cells taken from women who received both doses of the resveratrol. As is the case with many other polyphenols, resveratrol is poorly absorbed and largely digested into other compounds by gut microorganisms. Some of the health benefits of the polyphenols might be due to their ability to improve gut microbial composition. In addition, compounds that result from microbial digestion of resveratrol may in fact be responsible for many of the health benefits attributed to the resveratrol. Emerging research into the potential therapeutic role of the breakdown products from resveratrol and other polyphenols is ongoing. For more information about herbs, supplements, and natural treatment plans, check out my website.